The Americas can really be said to be a region of extremes. Stretching from the Arctic to Antarctica, it boasts some of the highest mountains, the driest desert, 3 of the largest watersheds globally, and includes remote rural populations as well as 4 of the world's 25 largest cities. There's considerable economic diversity as well. Most countries are middle income or even upper middle income, but there are high-income economies such as Chile, Canada, and the United States, as well as others that are extremely fragile, such as Haiti and Venezuela. And it's a region of more than 1 billion people, many of whom are on the move as they seek political stability or to improve their economic prospects. It's no surprise, then, that this region's health profile is as complex as its demography and geography. The Americas claim several achievements in infectious diseases, including elimination of polio and rubella, and the region has a bold plan to eliminate cervical cancer. But where extreme poverty and extreme wealth coexist, there is also hunger and malnutrition, alongside overweight and metabolic disorders. During the COVID-19 pandemic, countries of the Americas suffered 25% of COVID cases worldwide and 43% of deaths, nearly half of all those in the world. And recent years have seen countries contending with outbreaks of vector-borne disease, including dengue, chikungunya, Zika, and Oropouche. As the population ages, and now some 13% of the population of the entire region is over the age of 65, health systems are dealing with non-communicable conditions, including cancers, type 2 diabetes, and cardiovascular disorders. So how is this complex region protecting hard-won gains in health and longevity while addressing ongoing challenges and preparing for future health crises? Dr. Jarbas Barbosa Silva, Director of the Pan American Health Organization, or PAHO, here in Washington, D.C., joins me today to talk about health security challenges in this region of extremes and why it is important for countries to work together to achieve shared health goals.
This is the CommonHealth Podcast, a product of the CSIS Bipartisan Alliance for Global Health Security. We engage with diverse leaders on the question of how best to navigate this period of exceptional turmoil, reform, and uncertainty in U.S. leadership.
Hello and welcome to the CommonHealth Live. I'm Katherine Bliss with the CSIS Global Health Policy Center. And it's my pleasure today to speak with Dr. Jarbas Barbosa da Silva, Jr., Director of the Pan American Health Organization, or PAHO, in Washington, D.C. Dr. Barbosa, welcome to the CommonHealth.
Thank you, Katherine, and thank you for having me here.
Well, I know it's a busy time, so we're pleased to have some of your expertise here with us this morning. You've been at PAHO in a number of different capacities. As director since 2023, and as assistant director of the organization for 5 years before that, including during the COVID-19 pandemic. And if I'm not mistaken, you and I first met back in, I think, 2009 during the H1N1 influenza outbreak, when you were, I believe, head of infectious diseases at PAHO as well. And in the interim, you've held a number of positions in Brazil, your native country, related to disease surveillance, and were head of Anvisa, the regulatory agency within the Ministry of Health. So I think perhaps there's no one better to share an overview, to start off our conversation, an overview of PAHO, the roles that it plays throughout the region, and how the organization works with countries that are members. So I wanted to start by asking you to say a bit about how PAHO came to be and the extent to which health security is a focus of the organization.
No, thank you. PAHO was created in 1902. Mm-hmm. Remember that at that time, the first attempt to build the Panama Canal failed due to the yellow fever outbreaks that killed hundreds of the workers that were trying to build the Panama Canal. So this initiated the perception that the countries need to come together. In 1902, only 2 years after they created the Organization of the American States, they decided to create a specialized agency for health, the the grandmother of the Pan American Health Organization, to share information and to provide better response to pandemics and outbreaks. So health security is in our own DNA. PAHO was created to share information in a transparent basis and to provide a platform where countries can come together to better coordinate their common efforts to contain outbreaks and epidemics.
So if the countries in the region came together around challenges related to like port sanitation and, mosquitoes, vector-borne diseases, and really this issue, in particular around immigration and yellow fever with the canal, has the concept of health security evolved over time? And is there a common kind of understanding among the countries of, what they mean when they think about the health security of the region?
The countries have sometimes different perspectives about the health security. From PAHO, we believe that the health security is the capacity to prevent, to detect, and to respond to public health threats that can be a problem not only for the health sector, but can disrupt the economies, that can be a problem for the economic and social development. So this is health security, and we do believe that this is a very important part of security in general, because the COVID-19 showed us very clearly that if the health, people cannot live, cannot work, the economy is not running. So when we have an outbreak with that proportion, it's not the health that is affected, but it's the communities, the countries, the economy, and the social development.
So you've talked a bit about the COVID-19 challenge and how, that was maybe, I wouldn't say a wake-up call, but, really something that kind of, brought attention to this issue around the complexity of health security, the political and economic dimensions and the community dimensions that bring it together. What are some of the current kind of most, what are the issues in health security within the region that you and your team are putting most attention on at this point?
First, we need to strengthen national capacity, because we know that with the diversity that you mentioned, that you have in the Americas, with forests, with hundreds of viruses, some of them that are very well known yet, and some of them are changing their behavior, like Oropushi or chikungunya. So we need to strengthen the national capacity. Every country in this region needed to be ready to prevent, to detect, and to respond. Because also the lessons that we learned from the flu pandemic in 2009, now COVID-19, if we are not able to contain at the source, the small window of opportunity that we have, in general, when for some kinds of virus, they spread so fast that it's almost impossible to contain if you don't have this opportunity, and if you are not ready to act at this moment. So it's very important to have all the countries with this capacity. We are talking about the laboratory capacity, we are talking about the training healthcare workers, we are talking about the health information systems, we are talking also about the preparation that they need to deal not only with the future threats, but with the current public health emergency that they have. We now have measles outbreaks in countries. We have yellow fever outbreaks in 4 countries in South America. We have Oropushi. So dengue fever, last year we had more than 12 million cases. So they need these tools. They need to be prepared to respond to these current threats. But also is important, as a second pillar, is to guarantee that you have a platform that brings together all the information. PAHO, we run a regional surveillance system that first receives all the information from the countries. From Canada to Argentina and Chile, we receive all the information related to outbreaks, to diseases that are under monitoring. So we can receive this information and share this information with all the countries. But at the same time, we have a 24/7 system that is looking for words like fever, outbreak, diseases, new diseases, deaths related to anything. This system identifies almost 2 million signals every year. And the last year was a typical year, we handled almost 100 public health emergencies in the region. This is not only sharing the information, but provide the technical guidance to the countries, what are the protocols to investigate the cases, to have samples in the laboratory tests that they need to perform, and also deploying teams of experts when they need this kind of support. So I think that this combination of these two things is strong national capacity and at the same time a regional platform to coordinate and share information are the main pillars to guarantee that we have the Americas better prepared.
So it seems to me you've made a very strong case for regional collaboration, both in terms of ongoing research, identifying diseases, and then sharing that information and providing technical assistance among the countries to prepare and anticipate for outbreaks and other challenges that might be coming. As you said, PAHO was started in 1902 and really became part of the Inter-American system, right, with the Organization of American States and I guess Inter-American Development Bank and others. Of course, later in the 1940s, PAHO also became the America's arm or branch, I guess, of the World Health Organization, which started after World War II. Now, in January, the United States announced its intent to withdraw from the World Health Organization, but it remains part of PAHO. And so I wanted to ask you to say a bit about, why this engagement with the Americas is so important for North and South America and for the United States to be part of that, why it's in the interest of the United States to remain part of a regional organization. And if you could say a bit, too, about how, the relations between the regional organization of PAHO, continue and how that works with the other regional organizations of WHO.
Yes, PAHO is a double organization. As you mentioned, when WHO was created in 1948, the member states made the decision that the PAHO should also serve as the WHO regional office for the Americas. But we, at the PAHO, at that moment, it was also decided that the PAHO should not be integrated to WHO, that PAHO should remain as an independent organization. So our decisions are made here in the Americas. All the staff that we have, they are PAHO's staff, they are not WHO staff. And we have all the interactions with our member states on behalf of the Pan American Health Organization too. So in this condition, of course, that is important. And I think that the U.S., of course, that all the public health community in this country and in the world, we hope that this decision could be reconsidered in the future because it's important for the world and it's also important for the United States to be part of the global system. But this does not mean that the U.S. cannot be part of PAHO because PAHO has its own membership. So the two countries in the region that have already announced that they will withdraw from WHO, the United States and Argentina, they are still members of the Pan American Health Organization, and we do believe that this is very important. So they can be part of the regional efforts to protect the health sector, to protect the health of the population, but at the same time to advance the public health agenda in the region. So we have this, we can have these differences with WHO in membership. It's legally possible, because even the formal act to join WHO and to join PAHO from the United States are two different acts. So we are clearly an independent organization that integrates the inter-American system that serves as WHO regional office for the Americas.
So there's really kind of a historical difference in the organizations that kind of creates kind of a unique situation. One of the things I've always found so interesting about that history and about the long involvement of PAHO in the region is just the concept of solidarity that really kind of permeates all of the discussions, going way back. Yet, as you discussed, I mean, COVID-19 really hit this region in a very strong way. And of course, we know that there were very high mortality rates in a number of countries. And also, challenges in accessing medical supplies and accessing vaccines and other, measures to respond to the pandemic. And so I wanted to ask you to reflect kind of on the state of solidarity within the region with respect to health, and where you see PAHO, playing a role in helping countries to, think about how, as a region, they can be more, self-sufficient or, able to respond to some of those challenges around access in the future.
It's a very, very, very good point, Katherine. You are totally correct. The pandemic showed us that we need to change the way that we look about the capacity to produce health technology in the region. During the most critical period of the pandemic, our countries were struggling to have access to very simple equipment like masks and goggles and gloves. After that, they had to struggle to have the access to respirators, to medicines, to vaccines. So I think that this kind of triggered a political will to change the situation. Of course, that we need to be careful to present proposals that are feasible, because the experience during the pandemic was so dramatic that we had a period where every country in this region wants to produce everything, and we know that this is not possible. So attending or responding to the request from our member states, we established a regional platform to support some new technologies development in the region, to support the regulatory capacity in the region, so preparing the countries to be well equipped to research and development and production of products. And at the same time, we are using a unique situation that you have in our region, that is the pooled procurement mechanism that we call revolving fund. Revolving fund is last year procured around $800 million of vaccines and health technologies, $200 million from U.S.-based producers. So it's important also to have this participation from the U.S. private companies in this fund. And since last year, member states approved some flexibilities that I started using immediately. So in January, we signed the first agreement, PAHO, the government of Argentina, Pfizer, this very well-known vaccine producer in the US, and Synergium Biotech, a producer in Argentina. This agreement is allowing a tech transfer process for a very innovative vaccine, PCV20, is the new version of pneumococcal vaccine. And this also, at the same time, is strengthening the capacity to produce this vaccine in Argentina, and offering this vaccine by the most affordable price to every country in our region through our revolving fund. So I think that this is one example. We are now engaging with other producers to discuss the new HPV vaccine, for instance, the syncytial respiratory virus vaccine, and other vaccines. So the idea is to bring together the countries that they can produce not only the vaccines, because sometimes they want to produce vaccine, and vaccines are very complex products, but they could produce syringes. We have only one producer in the region that is offering vaccines through the revolving fund. We need to import millions of syringes every year from Asia and other regions. So we are encouraging countries, okay, maybe you can wait some years to develop your capacity to produce a vaccine, but you can start with syringes, you can start with medicines, you can start with other products that will complement the self-sufficiency, but I think that in the short period of time to reduce the vulnerability that you still have.
So you've mentioned in a couple of different ways how either through tech transfer or countries are beginning to develop more or kind of revitalize vaccine industries, I guess, because at least sometime back in the 20th century, I think there were a number of vaccine producing countries, and then that kind of died out for a while, and now there's an effort to continue to build that. At the same time, typically, or at least historically, the region has built pretty high vaccination coverage, right? Through the immunization week of the Americas, and campaigns, and really through the technical assistance and working with countries' immunization programs. In the years prior to the pandemic, though, we began to see a little bit of stagnation with respect to kind of overall coverage with DTP3, and other measures. And then the latest WUNIC data from the middle of July shows that the region still hasn't quite recovered to those pre-pandemic levels that were already kind of faltering a little bit. Of course, as you mentioned, in North America this year, we've seen measles outbreaks in Mexico, the United States, and Canada, in part driven by kind of pockets of low coverage. And, of course, there's recent data here in the United States that, the non-medical vaccine exemptions are on the rise in a number of different states. Just yesterday, Florida announced that, would be kind of looking to drop vaccine mandates for schools. And so, we know that whether it's the various factors that contribute to lower vaccination coverage, whether it's misinformation or circulation of news and other kinds of information, they don't happen in a vacuum. There's communication between countries and on social media and through different areas. So I wanted to ask you to say a bit about the state of vaccine confidence in the region and what steps PAHO is taking to work with countries to kind of reinforce, the emphasis or focus on immunizations.
Vaccination has been a flagship program for PAHO for many decades now. For this reason, the Americas was the first region to eliminate several diseases, from smallpox to polio. Mm-hmm. We are the only measles-free region until now. Hopefully, Canada, Mexico, and the US will control the outbreaks before the 1 year period that they have, so we will keep this certificate. But since 2015, the coverage started decreasing for different reasons. I think that first, the success of the vaccine, sometimes they play a role against the vaccines, because some families, they say, why do I need to keep vaccinating my child against polio when there is no case of polio since, 1970 something? Why do I need to keep vaccinating against measles when there is no case of measles in my community, in my city? So I think that this plays a very important role, and we need to work with healthcare workers, better physicians, nurses, because all the surveys that we have in the regions shows that the healthcare workers are the most important source of information for the families to make their decision about getting the vaccines. Second, we need to think about how to organize better the services, because with the very rapid urbanization that Latin America experiences, we have cities that change from 500,000 to 2 million inhabitants in 15 or 20 years. And the health infrastructure sometimes didn't have the same pace of increase. And even the way that we organize the service, I think that are important. Because with the new vaccines that we are introducing, this is wonderful, a woman or a man, but in general is a woman, because 50% of the poorest families in Latin America and the Caribbean has only one adult that has an income, and this is a woman. And this woman probably works in the informal economy, informal sector of the economy. So this woman needs to go 10 to 12 times to a health center in the first year of her baby to get the vaccines. So if the health center opens only Monday to Friday, 8 to 5, this woman will not go 2-3 times to get the vaccine. So if we are encouraging the countries, and we have very good examples in several different countries, opening them, the health centers on weekends, using new strategies like micro-planning that we are supporting the country to identify where are the pockets of low vaccinated children, so we can go there on weekends to get them vaccinated. So these are very important. We need very important lessons that we learn, that we need to change the way that the cells are organized to facilitate the access. And the third is misinformation. I think that misinformation is a very important component, and to address this challenge, we need to provide very transparent information to the families. It's not that they are anti-vaccine, but we have a growing number of people that they need to understand better how the vaccines are produced, how we can certify that they are safe, why they need to get vaccinated. So I think that in the past, the families, they could see a neighbor that had a child that with polio or measles. Now that they don't have these threats close to them, we need really to provide information. And again, the healthcare workers are crucial. They need to understand this. They need to listen. What are the doubts that the families have, and they need to translate the scientific information in a very simple way to share with the families why they need to get vaccinated their children.
So you've really outlined, the importance of a strong health system, from the national level, but really the importance of that primary health care, and the role of healthcare workers in communicating with families, building trust, and really kind of being part of the community. One of PAHO's priorities, really has been to support members' efforts to strengthen health systems. But one country that has really faced challenges in recent years is Haiti. And it's listed as among the most fragile states in the world, and ongoing violence and instability has really made it exceptionally difficult for providers to deliver health services, and really, I think, for people to even feel safe enough to go and seek them when they want to. Just recently, a state of emergency was declared in August, and I think it's, there's an estimate that at least 5,000 people have died in the past year alone from some of the violence that's really kind of challenging the delivery of services. Now, PAHO has long had a presence in Haiti, and so could you just, say a little bit about how the organization, can continue to work with, in the absence of strong institutions and really kind of a functional, full political system, how can PAHO work with organizations, to support and strengthen the delivery of health services, and what are some of the lessons from some of the other crises that the organization has faced that are kind of being brought to bear in the current response in Haiti?
Yeah. One important characteristic that we have is that PAHO has a very strong country presence. And the country office that we have 27 country offices. They are not a diplomatic representation of PAHO. They have a very strong technical team that works together with the Ministry of Health to strengthen the health agenda in each country. And in Haiti is one of the biggest offices that we have. Mm-hmm. We are still there, because I'm saying still there because due to the violence and the security situation, some organizations unfortunately had to close their office there, but the PAHO is there. We have a very strong country office that is working with the Ministry of Health and with NGOs and other organizations to in several different areas. We are working with NGOs to get the children vaccinated, and even in this difficult situation, we are getting around 80% of immunization coverage. We are working to stop the cholera outbreak, and we are completing 10 weeks with no new suspected case of cholera. That is a very important achievement. We are working with some innovative ways. We have these motorbikes with a small lab. So they go to the communities, they provide the test to the community, and they treat immediately people that get the test positive. So this is contributing a lot, and we believe that keeping the same pace of things, we can declare in some near future that the outbreak of cholera was completely controlled. But we are also working to keep health services open. Only 10% of the health services in Haiti are completely functioning. So we are, for instance, we are keeping the only hospital in Port-au-Prince, Hospital de la Paix, open. It's the only public hospital that has surgical capacity, blood transfusion, emergency room that is dealing with trauma, people that were involved in gunshots and things like that. From the January 2024 to now, we deliver more than 250 tons of medicines and health supplies to Haiti. We keep a warehouse there that we call Promise. And the in Promises, we keep all the vaccines and medicines that we provide to the Ministry of Health. So we are there. We really appreciate the working with several different partners. A very important part of these 250 tons that we deliver, we could deliver because we have a joint flights or used flights from the U.S. Army. This is a kind of partnership that is important to respond to the situation in Haiti. So now, within the Organization of the American States, there is this effort to bring together all the four institutions and the countries in the region, because Haiti is a huge problem in the region, not only for Haiti, but for Dominican Republic, with the problem of the migration, for several other countries, including the United States and other countries in the region. And if we don't improve the situation, the general situation, of course, but also many women from Haiti, they go to Dominican Republic because they cannot pay when they are pregnant. So if you don't improve the health system in Haiti to provide the basic services to their population, we are not contributing to reduce the migration. So it's important to improve the situation for the Haitians, but also to provide a better response to this massive migration that we have from Haiti.
So it really becomes an economic and political challenge for the broader region, with health playing a role in addressing and alleviating perhaps some of those issues. I want to switch gears a little bit to talk about some events that are coming up on the horizon that I think it sounds like offer a chance to perhaps address many of the topics that we've talked about. The first is in New York later this month, the 4th, I think, high-level meeting on the prevention and control of non-communicable diseases and the promotion of mental health. This will offer a chance to spotlight country commitments to addressing the impact of conditions like cardiovascular disease, diabetes, and cancer, among others, and gives a chance to take stock of progress in some of the previous meetings, and then for the different regions of the world to share experiences and, ideally, I think, sounds like come out with a declaration and maybe an action plan looking ahead. Obviously, NCDs have become a bigger part of the focus in the region over the past several decades. And now, of course, with an aging region that has lower fertility and longer, people are living longer. And so I guess have the opportunity to experience different health conditions as they get older. What are you, hopeful that you will see coming out of this meeting in a couple of weeks, I think on the 25th of September, so about 3 weeks from now. And, what do you think the Americas region, can really contribute to that dialogue? What lessons are there from the region that can inform the work?
This will be an excellent opportunity for the countries, first to reaffirm their commitment with non-communicable disease. Non-communicable disease is not only a public health problem, it also can, and is already providing very important economic loss to the society. We launched a couple of weeks ago a report that we worked together with the Harvard Public Health School. And the estimation for South America is that from 2030 to 2050, the loss provided by non-communicable diseases will correspond to one entire year of GDP loss. So we are talking about trillions of US dollars. People that are dying prematurely, people that will request services for decades because they will be needing physiotherapy, health support, health care. So we are talking really about the one thing that needs to be addressed not only by the health sector. This region has a very important role. In 2007, the heads of state of CARICOM, for the first time in Trinidad and Tobago, a historical meeting, they called the attention that the NCD is not only a public health, but also an economic and social problem. So now we will have the opportunity to reaffirm this commitment. PAHO is leading several efforts in the region. We have an initiative that we call Better Care for NCD that encompasses the two main aspects. First, to protect the new generations. So investing on prevention and promotion. We have many tools that are evidence-based that can reduce the burden of non-communicable disease, reducing tobacco use, for instance, increasing physical activity, promoting healthy diet. So I think that you have a package of intervention that you really can reduce your obesity, tobacco use, and prevent future and non-communicable diseases in the new generation. But at the same time, we need to provide care for people that already have hypertension or diabetes. After the 40s, probably 50% of the population, they have hypertension. And the real problem is that for each 100 people with hypertension in the Americas, only 50 are aware that they have hypertension, and only 25 have the hypertension controlled. For this reason, that the hypertension is the main risk factor that we have in the Americas and in the world to explain this very important number of deaths related to cardiovascular diseases. The problem with the deaths related to non-communicable diseases is that 40% of them are happening before the 70s. So we consider them premature deaths that probably could be prevented if we have the primary health care better prepared to offer diagnosis and treatment. In several countries in the region, Chile has already implemented the one initiative that we promote that is called HEARTS. Chile implemented this in more than 90% of their primary health care centers. El Salvador implemented in almost 100% of their primary health care centers. So this is starting changing the game. We have already experienced a reduction in 16% of the deaths when we look in the last decade. But this is still a challenge. We need to combine several different initiatives to facilitate the access. And we need to provide better use for the new technologies that are available, telemedicine and telehealth. So a health center in a remote area can have a teleconsult with a cardiologist if they need it, without needing to move this person 2-3 days of travel that they sometimes they cannot spare it. So this is, I think, that the main challenge that we have, the elimination of cervical cancer that you mentioned at the beginning, that's also very important, and providing better access for diabetes, hypertension, and cancer is part of this initiative that we are leading in the region.
So kind of going back almost 20 years, I mean, there's really a long history of thinking about diet, exercise, and kind of lifestyle prevention, but also really raising awareness within the health system and identifying opportunities to kind of initiate treatment and awareness earlier rather than kind of at a later point where the outcomes might not be so good. So, and these are lessons that can be shared with other regions as well.
Yes, I do believe that it's very important because this is a challenge not only for the Americas. Now, there's fortunately, we have this very rapid demographic transition here in the Americas, but other regions, in Asia, in Africa, also the countries are experiencing the same problem. because they need to be prepared to this aging population that will have a more important burden of non-communicable diseases, and they need to act now. Because when we see the figures that we have for children and adolescents that they are experiencing obesity or overweight in the region, in some countries we have very concerning figures. That is clearly telling us that we need to have a multi-sector approach. The health sector needs to work with the education sector, sometimes with agricultural sector, sometimes with also finance, the finance minister, because it's not only about receiving the information, but also having access. In the Caribbean, a family to purchase vegetables and fruits, they will pay 40% more than a family in the U.S. So even if they want to eat healthy foods, they cannot afford. So we need to have a broader perspective. In the health sector, I think that can play a very important role leading this multi-sector approach, bringing together to combine health promotion, information that are crucial, but also offering the access for people to have to make better choices about their health.
Into the fall, after the meeting on NCDs at the end of September, you've got your directing council and a number of other meetings kind of leading up to, I think in December, the Summit of the Americas, which is taking place in the Dominican Republic this year. And the summits are, convene heads of state from all of the different countries throughout the region, and I think, have typically had, kind of a broad focus on citizen security and prosperity for the region, but often have a health focus as well, at least a health working group or some elements of a declaration that focus on health. What are you looking for this year as the countries come together for that meeting at the end of, or the beginning, I guess, of December? And where do you hope to see health on the agenda in December and then into 2026?
The summit will be, I think, that an incredible opportunity also to provide better integration for health into the general perspective of the forum, the summit that is focused on security. We believe that besides the 4 pillars that the Dominican Republic government presented, and we agree that they are very important to be discussed for the region, but it's also important to have health as part of the security, because again, the COVID-19 pandemic showed us that if health is not working well, the economy will not work well. When we have a dengue outbreak in a country, the economic impact that they have is huge. When we have a pandemic, even non-communicable disease I mentioned, they are providing a very important economic loss. So health security needs to be part of this discussion, and we are having a very productive interaction with the government of Dominican Republic. But we also have other opportunities, because during the summit we will have the meeting of the private sector, and we want to discuss with the private sector to increase the conversation that we already have doing with them, to invite them to participate in the PAHO's revolving fund, so they can provide their products to be more accessible to our region, but at the same time to facilitate these partnerships that they can have with producers from Canada and the US, with producers from Latin America, in order to strengthen our regional capacity. I think that this is important for the region. If we have more capacity for vaccines, health technologies in the region, we will be less vulnerable when we need to deal with the current public health emergency, but with future threats that we have.
Well, Dr. Jarbas Barbosa da Silva, Director of the Pan American Health Organization, thank you very much for joining me today. And good luck with what sounds like an extremely busy few months ahead with both the high-level meeting, the Directing Council, and the Summit of the Americas. We've covered a lot of ground around the history of PAHO, the understanding of health security and current challenges in the region, and I think real opportunities for countries to come together, not just governments, but the private sector and community groups to strengthen primary health care in the health system and really identify opportunities to work together to prepare for future health crises and protect the gains that have been made. So thank you for joining me today, and thank you to all of you for joining us this morning.